The problem with the contraindications is that historically, if you go back, and I've got a collection of old textbooks going back to the 1940s, 1920s, you know, they all list contraindications because every modality, whether it's shortwave or ultrasound or laser, technically there's going to be a number of times when you really don't want to do that. And that's really what the contraindication list is. And then it got expanded and they had the contraindications, do not do it here. And then they had the precautions. Well, you know, probably best if you don't do it here. So, and over the years, loads of these things have just been passed down. It goes from textbook 1920 to textbook 1928. And you're thinking, where on earth did this come from? The point is that there are, effectively what we ended up with was a division into, let's say, the contraindications. The contraindications are absolutely do not. Whatever happens, do not. So, for example, if somebody's got a pacemaker and you want to use shortwave, which is radio waves, you shouldn't do that anywhere in their body, because wherever you turn the shortwave on in their body, it could make the pacemaker go wrong. We know that is true. Do not do it. All right? So that's a generic, a global contraindication. And there's actually very few of those. I know you're not going to see it properly, and the whole point is you can't, so don't take a picture of the screen now. But that, you know, that grid is the grid we have worked up, and that's the grid I'm working to. The red dots on there, and there's relatively few of them, the red dots on there are the absolutely do nots, and we can pick on a few of those in a minute as examples. So shortwave, pacemaker, good example.
And presumably that would apply to internal defibrillators as
yep.
well?
And anything which is inside the body with a battery, it's a no, don't do it. So an internal defibrillator, even a cochlear implant, anything that's internal and powered, that would be an example of a complete contraindication. There are things which are local contraindications. So a local contraindication, there's quite a lot of those, but a local contraindication says, okay, you've got, it sounds bad, I'm like I'm wishing it on you, you've got prostate cancer, you know, you've got prostate cancer, but I want to do ultrasound to your knee because you've got a knee problem. It's nothing to do with the prostate cancer. There's no reason why your knee problem is linked to your prostate cancer. The local contraindication would say, things like ultrasound, things like laser would be crazy to do in the immediate vicinity of your cancer or tumour. But it's perfectly all right at the knee, because if I do ultrasound to your knee, the energy I'm putting in is never going to reach the tumour. So local contraindication really means, does the energy reach the problem part? But the smaller the contraindication list, the better. But there's no way on earth none of us would want to put a patient at risk. So if it really is risky to do TENS to a patient who's got a pacemaker, let's just make it really clear. If it's perfectly all right to do ultrasound to somebody who's got a pin, plate, nail, wire, screw in their arm, let's get that news out there. So we.